Mandel, and I'm the current chair of the Community Foundation's Board of Trustees. We've got a little bit of housekeeping to do. As you just noticed, we are going to record, and this recording is going to be available on the website and our YouTube channel later on today if you need it. As I mentioned, you may want to use the speaker display, but that's up to you. And as everybody's putting their name in the chat box, please continue to do so if you haven't already. Thank you. There may be time for Q&A at the end of this. If you find that your question is unanswered or something you think of something afterwards, you can contact either Eric, Dr. Devereaux, or the Community Foundation, and we will follow up with you. And I know I don't have to tell you this, but you know where your bathrooms are. I don't have to point them out. So now to the reason why we're here. We appreciate you joining us today as we share valuable insights from our recent Frederick County Human Needs Assessment and Update, and as well as what it means for the Community Foundation, for the nonprofits, and for our community at large. For more than 3 decades, the Community Foundation has been helping people translate simple good intentions into powerful and lasting acts of philanthropy in a way that builds a stronger, more vibrant community. The Community Foundation continues to work as a community leader who collaborates with partners to identify and address the county's most pressing human needs issues. Through our work with generous donors, we're able to create positive impact in every corner of this county. In fiscal year 22, we infused more than $751,000 into 26 nonprofits in a strategic grant process in the Frederick County community. We're proud of the difference that we make in the lives of our citizens by partnering with these generous donors and other agencies and organizations. Now, what I'd like to do is introduce Ian Bartman, who's the champion of the updated Needs Assessment Committee and our incoming chair for the Board of Trustees. So he's going to give you a little more information and detail about the assessment and the process. Ian?
Thank you, Dr. Mandel. Good morning, everyone. I see a lot of familiar names on the participant list and thank you all for attending the presentation this morning. For those of you who do not know me, my name is Ian Bartman, and I have served as a trustee of the Community Foundation for the past 3 years. I'm really looking forward to serving as the chair of the Community Foundation's Board of Trustees in the coming year. The Community Foundation conducted the 2018 Human Needs Assessment to shape its strategic funding initiatives in Frederick County for the next 10 years, as well as to provide a valuable information resource to government, philanthropies, and nonprofits to assist with setting priorities in Frederick County and verifying our needs. Community Foundation commissioned this 2022 update to the 2018 Human Needs Assessment in order to address the impact of the COVID-19 pandemic on human needs in Frederick County. Both the 2018 Human Needs Assessment and this 2022 update were conducted by Dr. Eric Devereaux. Dr. Devereaux is a strategic consultant and policy analyst with expertise in quantitative and qualitative research, data analysis, program evaluation, and the logic of policy interventions. Recent clients of Dr. Devereaux include scientific societies, mission-oriented nonprofits, and university. He also has a distinguished record of teaching public policy analysis at such institutions as Carnegie Mellon University, American University, and Georgetown University. The findings of the 2022 update show that the 3 key areas of need identified in the 2018 Human Needs Update remain critical areas of need, but it also revealed that several overlay areas warrant attention. The 2018 and updated 2022 Human Needs Assessment documents are available on the Community Foundation website at www.frederickcountygives.org. I'm now going to turn it over to Dr. Devereaux to walk us through his process and findings.
Give me 1 second here. Hold on. I apologize. I have to unmute. Okay, good. I am unmuted. Thank you very much, Ian. I really appreciate that. And thank you much, Rachel, as well. It's a real pleasure to be with all of you here today to talk about what we've learned this year, to update what we learned in 2018 about human needs in Frederick County. I've got a brief presentation to go through, and I believe there's going to be a Q&A period at the end. You might want to put questions in the chat and then we can take them from there, or there may be an opportunity to ask directly online. I'll let the Community Foundation personnel who are helping to run this event direct that at the end. So let me just get right into it and say that Betsy Day and other leaders at the Community Foundation came to me in 2021 and said, we have a feeling that COVID and the COVID pandemic has really changed some things in the county, perhaps permanently, that affect the findings from the 2018 Human Needs Assessment. We want to know what's going on with that. We may have to realign what we're doing and change our thinking about different issues, and we want to make that work for the county. So what we decided to do was to do the update earlier this year and do it predominantly through talking with thought leaders in Frederick County. So let me just go down an overview here of what I'm going to do for you today. First off, I'm going to talk about the purpose of the HNA update in a little more detail. I'm going to review briefly for you the previous two human needs assessments done in 2011 and 2018. I'm going to talk about the 2022 Community Health Needs Assessment, which came out in the midst of doing this update. A little bit about the methodology for updating the Human Needs Assessment. Going to talk to you a bit about what the impact of that 2018 Human Needs Assessment was on the thought leaders that were interviewed for this update. Look at COVID's impact in Frederick County, what we learned about that. Look at what are the human needs priorities after the COVID pandemic recedes, and we do hope that the pandemic will continue to recede, having sort of mixed messages about that right now, but it looks like it is slowly but surely beginning to recede. Talk some more about some challenges in Frederick County, the implications of the HNA update for the original Human Needs Assessment, and then we'll have a discussion. So let's start out with the purpose of this update. So again, the question was whether or not the COVID-19 pandemic merited redirecting what the Foundation's strategic directions are in the context of the aftermath of the pandemic. So there are some specific questions that were on the plate. First off, are the needs identified in 2018 still the most prominent? Are there new gaps in services or waiting lists for services that need to be addressed now? And has the pandemic changed the issues that Frederick County households are facing, perhaps permanently? So those three questions sort of drove what I did in pursuing an update to the 2018 Human Needs Assessment. So let's go back first and look at where this all started out with. So in 2011, the Community Foundation sponsored a Human Needs Assessment, and these are the focus areas that came out of it. Healthcare, including mental health, services for youth, defined as birth through age 24, including childcare, and basic needs, including housing. That was the background to the 2018 Human Needs Assessment, which came up with some additional focus areas that have a heavy overlap. Supporting families with children of all socioeconomic backgrounds and trying to make Frederick County a really terrific place to raise children. Preparing for a growing elderly population, and just like everywhere else in the United States, the elderly population in Frederick County is among the fastest growing segment of the population. And within that fastest growing segment are the so-called super seniors, 80 years and older, who are a rapidly growing share of the elderly population and have very different needs than the 65 to 80 age group. And then responding to substance use disorder, including opioids and alcohol. In 2018, opioids were all over the news. There was perceived to be an opioid epidemic, and all sorts of things were happening in the community about this. But in the background, so opioids were sort of like the rapidly burning brush fire that everybody was noticing on the side of the highway. But in the background is a slow burning forest fire in the form of substance abuse disorder related to alcohol. And many of the experts that we spoke to said that from their perspective, well, the opioid epidemic was terrible and it was killing people. The fact was that alcohol issues in Frederick County at the end of the day were actually far more important in the long term. So one of the things that the 2018 Human Needs Assessment recognized is that all of the issues that were identified in 2011 were still persisting to this day. when we launched the update to the 2018 Human Needs Assessment earlier this year, the 2022 Community Health Needs Assessment was just coming out. So these are the areas that the Community Health Needs Assessment recognized needed to be areas of focus for health issues in Frederick County. Trauma and adverse childhood experiences, ACEs, diabetes and its co-occurrence with obesity, and mental health. And as we will see as we continue discussing what was learned about updating the 2018 Human Needs Assessment, these issues have a very strong overlap with other issues that were already of concern. And most important to note that this Community Health Needs Assessment definitely influenced the update to the 2018 Human Needs Assessment, because many of the same people were involved in Frederick County as thought leaders guiding the Community Health Needs Assessment. And it's not a surprise there was an overlap. And I just want to keep that in mind as we go through what I found in doing the update.
Okay. Eric,
Yes.
do you have a live transcription button at the bottom of your slide, your screen?
I think I do.
Can you enable that for us, please?
I will do it. I've never used it, so good luck.
There you
Okay,
go.
there we
Perfect.
go. All right. Happy to do it. Okay, so let's talk now about the methodology for updating the 2018 Human Needs Assessment. So we gathered expert and community input through key informant interviews that were requested by the Community Foundation. So the Community Foundation gave me the lists of persons to interview. So I completed 35 total interviews back in February and March. I think one leaked into April. 20 informants in the public sector, 14 leaders of nonprofit organizations. There was one informant who, a retired person, who represented a specific community of concern to the Community Foundation, who was also interviewed. 22 of those 35 people were interviewed for the 2018 Human Needs Assessment, so there was very significant overlap. If you look in the report, which is available to you on the Community Foundation's website, you will see the list of the persons who were interviewed. So several of those persons are actually, I believe, with us today during this presentation. I used a structured interview protocol to ensure consistency across the interviews, and that is found in Appendix B of the report if you want to see that protocol. Okay, so the interviews were completed January 20 to March 14. I don't think one actually got into April. The interviews took about 45 minutes to an hour to complete, and all the key informants were guaranteed confidentiality to encourage forthright responses, which means that the written report doesn't identify any remarks related to any specific person, tries instead to integrate across all the different interviews, find the key points of agreement, and not dwell on what any one particular person had to say. So one of the questions that I asked in this process was, how did the original 2018 Human Needs Assessment impact the work of your organization? And here's what the interviews found. So first off, we asked them if they had reviewed the 2018 Human Needs Assessment recently, and in particular to get prepared for the interview I conducted with them earlier this year. Many of them reviewed the executive summary of the original report. A few of them reviewed the entire report, and some of them reviewed the data visualization tool that is attached to the report that allows you to see data on a wide variety of important trends affecting Frederick County. And if you haven't looked at that data visualization tool, not only do I recommend you do that, but there's actually a separate YouTube video available on the Community Foundation's website that takes you through the entirety of the tool and explains what the different visualizations are about. As you can see, some had reviewed the materials previously, maybe going back several years, and then some had not reviewed some of the materials at all. So that was interesting to note. I've already talked to the Community Foundation a little bit about this finding. I also asked, as I said before, did the Human Needs Assessment influence the work of their organizations? And 17 of 35 said yes, and there was often considerable influence for the nonprofit organizations. 13 of 35 said no, it had not really influenced their work in any particular way. 5 of the 35, it wasn't an applicable question because they weren't with that organization when the Human Needs Assessment came out. And many of them had arrived in Frederick County so recently that they were still getting their feet on the ground, let alone having a chance to review these kind of materials. But there was a pattern here that suggested that it's going to be necessary to pursue some alternate strategies to push out this information to some of the key leaders in different organizations in Frederick County and try to get more visibility and more impact from the human needs assessment. I've already talked to the leadership of the Community Foundation about that before. So the next question was, how did COVID affect Frederick County? And what I asked the key informants was to think about the COVID pandemic and its impact on human service systems as a type of a stress test, similar to piling up as many cars as you can on a bridge and then see how many you can put there before the bridge falls in. In this case, what type of stress test did COVID represent for Frederick County? And what did they learn about that stress test, both positive and negative? So first, let's look at the positive aspects of what COVID revealed in Frederick County. It revealed that there were many instances of effective coordination among philanthropies, nonprofits, and Frederick County governments. So there were many instances of coordination that were like sort of shining examples of the community coming together, pulling together to try to get through the pandemic, especially really before there were COVID vaccines, and COVID was having a very high mortality rate relative to other similar infectious diseases like the flu. Many key organizations were able to pivot rapidly to remote work and use teleservices to continue serving the community without significant loss of functions. There was a really rapid pivot that many organizations did. The one thing I found in talking to some persons in Frederick County was a belief that telework wasn't, that virtual work, working from home, remote work wasn't actually work at all, which is a very unfortunate perception, because what I found in talking to the 35 people I interviewed was that when they shifted to remote work, they basically, from that point forward, never stopped working. They were talking about 14-hour days, 7 days a week. And because they were doing it, not in an office, but in their homes, they were somewhat invisible to some people in the county. But I've encouraged everybody who I've talked to make people realize that it was quite the opposite. It wasn't that people went home and didn't work. It's that they went home and they worked 4 times as much as they had been before. And in fact, the burnout is a real issue, which we'll talk about in a minute. There was a lot of additional funding that flowed in to address the crisis, and I'll be talking about some aspects of that. But a lot of funding came out of the philanthropic community. And as we've documented in a completely separate report sponsored by through the Osherman Family Foundation, about $2 million extra alone flowed in from philanthropies into Frederick County to try to bridge gaps that were affecting nonprofits, especially in the first 15 months of the pandemic. And there was a strong sense of community purpose, a real sense that the community was pulling together and trying to get through this crisis together. These were all the positives. Let's look now at the negatives. So first off, there was a long delay in the government response. It just takes time for governments to marshal the financial resources in order to address a crisis like this, because you have to go through a series of political channels to get the resources authorized, both at the federal level and at the state level. And much of what goes on with Frederick County government flows down from the state level. So that the delays between the feds and the state resulted in a long time period, about 15 months, when most of the funding gaps had to be filled in by non-governmental sources. Those non-governmental sources did their absolute best, but they could not marshal the level of finances that governments can. There remained many instances of a duplication of services, lack of coordination, and competition for the same resources during especially the earliest days of the pandemic. So while there was a lot of coordination in some instances, there remained lots of non-coordination and competition that had some very negative consequences for maintaining vital services in the county. So while the county can definitely improve that coordination aspect as it prepares to face another crisis of that nature. And I must emphasize that every expert that I trust and believe is predicting that it's inevitable we will have other crises like this. And in fact, we may be on the edge of one right now, if you've been following what's been going on with what's now being called Mpox. It's right on the edge of tilting into another serious public health problem. And I just got back from New York State, and I was very close to the part of New York State that appears to be having, of all things, a polio outbreak among unvaccinated populations. I find that almost incomprehensible. We all think of polio as a disease that we put behind us, you know, sometime in the latter half of the 20th century. And yet right now, as I speak, they're having a polio outbreak in New York State. Teleservices did not uniformly serve the needs of the population. Interestingly enough, teleservices apparently did the best for populations that had not been receiving direct services previously. If they only knew teleservices, then it seemed to go more smoothly than if they'd been receiving direct services and had to shift to teleservices. But there were a lot of disparities built in here. As you can imagine, if you have difficulty accessing the internet, then you're going to have difficulty accessing teleservices. There were therefore significant disparities in COVID's impact based on income, race, ethnicity, age, gender, and location across Frederick County. So disparities was one of the themes that emerged from almost every interview that I conducted. COVID revealed the underlying disparities in Frederick County in sharp relief in a way that had not really been fully seen before. And I want to emphasize that about this issue of location. I mean, we all hear about disparities based on income, race, and ethnicity all the time, some on age, but location proved to be a huge issue in Frederick County. In some parts of the county around Frederick City and south of Frederick City, location-based disparities were not that noticeable, but west of Frederick City and north of Frederick City, very noticeable. There was a huge unmet need for English-Spanish bilingual services. That need still remains. I've made some recommendations to various nonprofits I've spoken to about this, and my recommendations have been, instead of trying to reach to the outside and find experts in your area who are already bilingual, or alternatively trying to take your existing staff who do not speak Spanish and teach them to speak Spanish, what you need to do is find out if you have people living in the area who are bilingual, who could be trained, brought in and trained to do the work you need them to do. So start with the bilingual piece, not the previous training piece, and develop that internally inside the county. And you have plenty of bilingual residents. They just need the training to do the work necessary. But that's easier. That's going to be easier to do than trying to deal with the language piece among those who are not bilingual. And the unfortunate reality is that learning a second language as an adult is extremely difficult. Housing in Frederick County went from expensive to unaffordable to nearly unobtainable during the ramp up into the pandemic. This was for several reasons, but one of the things that did not help were lots of wealthy individuals who previously lived outside Frederick County who said during the pandemic, hey, I could live anywhere. I don't have to live in where I'm living right now. Where would be a nice place to live during the pandemic where I'm working from home? And some of them settled on Frederick County. And when they moved in with a lot of additional income, they drove rents up very high. And I have heard many accounts of, in Frederick City alone, 2-bedroom apartments renting for $2,400 a month, which used to be sort of the level of renting in downtown Washington, D.C. And there was much accumulated stress on frontline workers, and burnout remains a huge issue among them. Burnout remains a huge issue among everybody involved with trying to address the pandemic. And I'm not sure what exactly has been done about that at this point, but it is an issue that will come back to haunt Frederick County if people walk away from these types of positions because they're just too burned out. And access to childcare became absolutely crucial. The childcare system went into full-blown crisis. It still has not recovered. Many organizations had to step into the breach to at least provide childcare for frontline workers, which they did, but the entire approach wasn't sustainable in the long term financially or practically in many cases. And the childcare issue, which has been discussed in several human needs assessments in the past, became one of the top issues just to keep Frederick County working during the pandemic. All right, next set of questions asked to the key informants was, what do you see are the human needs priorities after COVID? We're still struggling to come out of the pandemic. I had thought when I did these interviews at the earlier part of this year that we would be seeing a light at the end of the tunnel, but it's unclear if that light isn't in fact an oncoming train. Unfortunately, the pandemic is having a very long tail with all these different variants, some of them becoming highly contagious. The only good news is that with very high levels of vaccination, we're seeing far fewer hospitalizations and far fewer deaths, but we are probably seeing very high levels of infection. It's becoming increasingly hard to know that because people are taking all these home tests and not telling anybody about the results. But the belief among experts is that we're seeing very high infection rates right now everywhere because of these very infectious variants. When I asked about what were the human needs priorities after COVID, I did not prompt anybody about any particular issues. I asked them to speak openly, and then I aggregated across that and identified the most mentioned and discussed issues. So these were the three most mentioned issues: mental health issues, affordable housing, and diversity and disparities based on income, age, gender, race, ethnicity, and as mentioned before, location in Frederick County. Mental health is the issue that basically is turned up in every human needs assessment, the community needs assessment. All of them have overlapped on mental health issues. And mental health is turned up in previous needs assessments. Did not surprise me, it was one of the most mentioned issues. Affordable housing was discussed a lot in the 2018 Human Needs Assessment, but for a variety of reasons, I recommended, the Community Foundation agreed, that affordable housing issues be linked to other issues that the Community Foundation can pursue, because the Community Foundation at the time didn't have at its means a way of directly impacting the affordable housing concerns of the county, and it was looking for its own strategic directions. But I've made some additional recommendations about this finding that have to do predominantly about supporting advocacy around affordable housing in Frederick County, as opposed to, for example, trying to directly get involved with building any type of housing. And I just want to emphasize this diversity, disparities issues, and the sharp relief that the COVID pandemic brought these issues into view were on everyone's minds. Then there was a second tier of concern, and these are very serious issues. They should not be downplayed. Transportation, what's going on with seniors and aging, income and jobs, healthcare in general, substance use disorder, which continues to be a major issue, and childcare. So all of these issues have been discussed before and come up before. There's just different levels of priorities that have been affected by what's happened during the pandemic. And then I have a sort of a summary here about income and job-related issues. These were mentioned directly by about a third of the key informants, and most of the key informants linked these issues or related issues to the intersection of disparity and poverty. And I want to emphasize the geographic disparities, the urban versus rural disparities, as being important as any other divides accentuated in Frederick County by COVID. And of course, the real risk here is breaking the community apart, where instead of the whole county working together, you have a sort of an us versus them situation developing. And this is one of the biggest issues, I think, at the broadest level facing the county post-COVID, is how to maintain a sense of community, collective community identity, and the community coming together to work as a whole when you have these geographic disparities that are in such sharp relief in Frederick County. So I also asked you, what do they saw the challenges looking out over the next 5 years? And the first thing I asked was, what is your view about the future? How positive are you about the ability of Frederick County to address its human needs over the next 5 years? So 9 of the key informants were very optimistic. 20 were cautiously optimistic. Only 6 were either cautiously or very pessimistic about the next 5 years. So there's a lot of optimism among the key informants that I spoke to, of these thought leaders. Now, this is not a public opinion survey. Please don't treat it like a public opinion survey. But if you look at the list in Appendix A of the report, these are people who really have their finger on the pulse of the county. And so I was heartened by the fact that they were either very or cautiously optimistic in general about what's going to happen in Frederick County over the next 5 years. But, and these were the sources of optimism: the ongoing coordination of services and attention to coordination of services, the level of community engagement that COVID revealed, and the additional resources that have come to the county to address human needs. These were all sources of optimism. But then there's some sources of pessimism: the difficulty of the perceived challenges coming ahead, the rigid silos that remain in the county in terms of organizations not working together or competing for the same resources. And then a tremendous political uncertainty. Just like everywhere in the United States right now, we're in a time of tremendous political change. And political change can have, as you know, in Frederick County, a big impact on the direction that the county government goes, the issues it takes on as important and unimportant. There's an election going on. I'm not going to go a lot of detail there. The Community Foundation, as you know, does not get involved in those types of issues. It's not something that we would ever want to do. But I did hear from the key informants that they were very concerned about political uncertainty at this time. And I just want to address this just myself in a little more detail quickly. When Betsy Day reached out to me in 2018 about the human needs assessment, one of the things I remember her talking to me about was about how in 2018, she said, we think something really special, positive is going on in Frederick County. And then we found out that a couple years earlier, out of more than 3,000 counties in the United States, the New York Times, using a very systematic ranking system, had ranked Frederick County as number 68 in the entire United States, which means it's in the top 2% of all counties. And those rankings were based on things like average education level, health outcomes, income, really important measures of community vitality. I have to say that in the 5 years since then, and especially post-COVID, what you see happening in Frederick County is a lot of things happening that go against that optimism of 2018. But it's not because anything that Frederick County is doing right or wrong per se. It's because of a set of societal pressures and forces that are beyond Frederick County's ability to control, especially related to cost of living and housing issues. And what's happening, and COVID brought this into, I think, greater relief, is that people are moving toward Frederick County out of Baltimore County, Howard County, and Montgomery County because of cost of living issues. And trying to stop, and these are not, by the way, recent immigrants or undocumented persons who you can arrest and deport. That's not the issue here. The issue here are lots of lower income or middle income Americans in the region who are being pushed out of those other counties by housing costs and related costs and looking for somewhere to live where they can still work, where the major job centers are in the Baltimore and Washington, D.C. area, but still have housing. And these forces are beyond Frederick County's control. But it means that over time, the entire socioeconomic makeup of Frederick County is shifting. And I would say that the real political challenge, just like it is now being discussed with regard to climate change, something else Frederick County, of course, can't affect on its own. The real political challenge is not how do we roll back to where we were 20 years ago, because that is never going to happen. The real political challenge is resilience. How is the county going to be resilient in managing these changes so that it can make the best of them and have the best possible outcomes? But trying to say we're not going to accept these changes and we're going to stop them, that's not political leadership. That's just burying your head in the sand. And I would say anybody who tries to advocate for some form of rollback to the cherished past is not actually dealing with reality head on. I'll move on from that. So here are some implications of the HNA update. Let's go back to those questions again. Are the needs identified in 2018 still the most prominent? Yes, in general, those are still very prominent needs. They have some different components to them, but the fact is that what's going on with families and children in Frederick County is still incredibly important. And the county still needs to try to be the best place possible for families to raise children, because that connects to the next one. That connects to the next issue. What's going on with seniors and aging? Well, that process continues. And if the county doesn't make itself a great place for families with children to live and to raise children, then what's going to inevitably happen is that population will decline, but the senior population will not decline. If you want to see a county that's grappling with that right now and its implications, all you have to do is look one county to your east and look at Carroll County, and we have this in the data visualization tool, and you can see the comparison there. Carroll County is rapidly aging. It's having big stresses regarding shutting down public schools, which are no longer actually needed, and all sorts of stresses related to that. And I would encourage Frederick County to try not to go down that path. And then substance use disorder is just a burning issue that still continues to take lives and to damage lives. So those issues have not gone away. They are still important. But overlaying on top of that is this entire issue of diversity and disparities. And that overlay is incredibly important to recognize that all those issues, families with children, aging, substance use disorder, there are disparities built into there, and they connect to a lot of other issues like housing and transportation and mental health and all of the other issues that these different human needs assessments have brought out. Are there new gaps in services or waiting lists for services? Well, the biggest gap that was revealed in this human needs assessment is the gap related to bilingual ability to serve the Spanish-speaking community. That is probably the single biggest one. And the second one are gaps that are related to the digital divides and disparities for access to the internet and the ability to receive teleservices. Those are several that came out very strongly. But those are, again, overlaps on top of these other human needs. Has the pandemic changed the issues that Frederick County households are facing? No, it's just accentuated them. And again, it's accentuated in a way that I think that, again, the challenge right now is to find a way for the county to be resilient in the face of these challenges and address them and turn them from a negative to a positive. But all it's done is accentuated the issues, not really changed them. All right, that's what I had prepared for now. And I thought I would stop there. And I will now turn it over for questions and answers, but I have to rely on the staff at the Community Foundation to lead how the Q&A is going to go.
So Eric, thank you so very much for your presentation. A question was asked, would the slides be available? And I said, yes. We can send, since we have all of your email addresses, we can send them out, a copy out, as well as we can have this reside on our website as well. So thank you for inquiring about that. And Eric, excellent presentation as always. You take complicated information and make it understandable for those of us in the general populace. So I thank you for that. We've had a number of questions posted in the chat, and if it's okay, I'd like to just go through these and talk a little bit about. One of the first questions was posted, Eric, and we wanted to confirm, what is your definition of a senior? And you also mentioned super seniors. What's the age ranges?
So we just use what has been the historical definition that senior starts at 65 and super senior starts at 80.
Okay.
That's basically a common definition of those two things, right?
Okay. Thank you for that. Switching gears a little bit, there was a comment made about housing was unaffordable prior to the pandemic, and it's absolutely in a crisis now. And housing has to be built. It just doesn't even exist right now. And I believe your comment about advocacy was directed at the Community Foundation because we don't have the funds. We wish we had the funds available for building and actually doing that kind of investment in the community. But what we can do is advocate and use some of our muscle power, with our voices as well as with our funding to help advocate. Do you care to talk a little bit about that, Eric?
What I had in mind was that the Community Foundation would use some of its grants to support organizations that are already advocating for affordable housing, instead of advocating directly, which may not be something the Community Foundation would really feel comfortable doing. Instead, it would just, so one of the things there's going to be a presentation on September 30th in the morning at the Maryland National Golf Club in Frederick County of the latest results of sharing grant-making data across 11 major philanthropies, including one part of Frederick County government, for the grants made in 2021. This is the second year that we're doing that. We'd already did a presentation about grants made in 2020, but that was a very strange year because that was the crisis year of the COVID pandemic. 2021 is going to be the first time we're looking at data after that crisis has receded a little bit. But what we consistently find is that none of the philanthropies in Frederick County are giving significant amounts of money in their grant making to organizations that conduct advocacy. And advocacy is different than lobbying, and that's been one of the issues I've been trying to get everybody to recognize. Advocacy is about an issue and asking those who can address that issue to please address it. and not let it lie in the background. Lobbying is about specific pieces of legislation. There's been a reticence on the part of the philanthropies to get involved with supporting lobbying, but that's not what I'm recommending. I'm recommending that they support the advocacy organizations that are already in the county that are advocating for change. And there are definitely advocacy organizations in the county advocating on behalf of affordable housing. But affordable housing is a really complicated and difficult issue in a variety of dimensions. There is an Affordable Housing Council and other organizations that influence policy in the county, and they've recently made several changes trying to do what they can to encourage the building of more affordable, so-called affordable units. But the underlying problem here is that the definition of affordable is actually a definition that does not produce housing that any of us would see as affordable for people who are working at the very lower end of the income scale. So these are people who have full-time jobs, maybe multiple full-time jobs, but they are minimum wage jobs. So they're working full-time and their income is still not sufficient to get to that affordable housing threshold. And there are communities around the United States that are really experiencing some really astounding problems because of this. And probably the poster child is San Francisco, California. So what's happening in San Francisco, California is some of the most famous restaurants in America are shutting down. They're shutting down because they can't afford to pay enough for anybody who would work in the kitchen to work there. Previously, there were people sleeping in their cars overnight so they could go back to work in these restaurants, and that's coming to an end. City of San Francisco isn't permitting that, doesn't really want people living in their cars. But the result is no restaurant workers, no daycare workers, no house cleaners, a wide range of workers who are necessary to support a city aren't going to be there anymore if you have to go down the road of what is currently the affordable housing standard. Can you imagine a city with no restaurants, no grocery stores, no daycare centers, none of the services at all? How's that city going to prove survivable for anybody else, right? And this is what happens when you lack affordable housing, or else you have large commutes. Now, the only advantage Frederick County has right now is it has other surrounding counties where housing is even less expensive and the commute isn't that bad. So what you've seen this, you've seen people being pushed out into West Virginia, into the county in West Virginia that comes close to touching Frederick County, into the counties in Pennsylvania that are just north of the border, into Washington County. But the problem is, what happens if you raise gas prices to $5 a gallon? For those households, that's an absolute crisis. Literally choosing between going to work and feeding your children is what that can mean, right? So these things just start compounding themselves. So a new approach is needed to this. And people have talked about this new approach would look like. But every direction it goes, it changes the nature of Frederick County permanently. And this is what you all have to grapple with about resilience. One example, and I'll stop, is that both from an environmental perspective and an affordable housing perspective, the best solution by far is high density housing. High density housing is how you solve some of the climate change issues related to housing. What are we talking about? We're talking about large apartment complexes, tall, large apartment complexes. This is not the vision any of you have for what downtown Frederick City would look like, right? But that is one of the solutions that produces affordable housing that's also environmentally sustainable. These are the types of issues that have to be grappled with now, but you're not going to solve it by building many more single family residences in lovely suburban, landscapes with lots of land around the houses. This is not going to solve the affordable housing problem, but is the vision for what people would like housing to look like in Frederick County.
So Eric, pivoting a little bit, there was a question in the chat about Frederick County has a significant population of deaf and hard of hearing. And also, was there any conversation about ability, disability in the key informant conversations that you had? Other
than the recognition that they were part of the disparities, all part of the disparities that were accentuated by the pandemic, right? I did talk to individuals who were deeply involved in those issues, but they didn't want, so I sensed a desire on their part to not accentuate that particular dimension because of wanting to mainstream a variety of situations and not segregate them. But I think they all recognize that a variety of disparities were highly accentuated for people struggling with different forms of disabilities during the pandemic related to teleservices and transportation, access to healthcare. All of these things were accentuated for them just as much as for anybody else. But it did not rise up as an issue that anybody pushed to the top of, other than being embedded in all these other issues, right?
Thank you for clarifying. One of the things that I want to make mention of, Eric made mention of the presentation he's doing to the funders group, where we're going to examine our own funding, not just individually, but collectively, and see where we're placing emphasis and seeing if we can create some synergy into where do we want to go next. One of the questions was in the chat was, what are the next steps? And I think after we have some conversations at the end of September as to where we want to go, if there's some collaboration, et cetera, we'll figure out from there what are the resources that we have, what are the resources we need to raise, and what do those community conversations look like as well.
Let me just say one thing here, because I can say this without getting anybody in the Community Foundation in hot water, because this is my view, not theirs. I want to make that very clear. Mine, not theirs, right? So I want to circle back to this issue of the existing silos, the continued competition for limited resources among nonprofits involved in direct services to different communities in Frederick County. There's going to have to be some very difficult conversations about how to pursue additional collaboration and cooperation and do as much as possible to break down those silos and end competition for resources. This is moving from a nice idea to an absolutely vital idea. And it would be better for everybody involved to work this through negotiation now without an extreme crisis pushing it. Because during an extreme crisis, some of the solutions might not be the ones everybody at the end of the day would prefer. And now is a chance to get some solutions in place that everybody does prefer. And to just put this in more specific context, nonprofits that are serving exactly the same communities with exactly the same services need to find a way to cooperate and coordinate among themselves, and maybe even in some cases even pursue some form of merger. From the perspective of the funding communities, both in government and in the philanthropic side, it's going to become increasingly difficult to juggle all these competing demands for the exact same resources to do exactly the same thing. And one of the places where this has really come to a head, and I'm hoping there will be further conversations in Frederick County, is with the Emergency Food Network. The Emergency Food Network is one of the shining examples of how Frederick County came together to solve a problem. In fact, I'm hoping somebody will write that up in great detail and push it out there for the world to see, because in a very short period of time, a variety of funders and service providers came together and rationalized the Emergency Food Network as best as they possibly could, because when the network first tried to address the impacts of COVID on hunger, there was a lot of chaos. There was food going where people couldn't get it. There was food not going where it was needed. There were issues with the food that was being provided. And very quickly, a variety of leaders in the community stepped in and rationalized that process as much as they could, because at the end of the day, the problem was people are going hungry. And among that group that's going hungry are children. It's just not acceptable, right? It's just not acceptable. So that was an example where there was a lot of effort to do that, but there was friction, there was still existing competition. And delving into that example can teach a lot about what needs to be done in that regard. But this is the time to do it, because the crisis has abated a little bit. There's a chance to take a little breath, and try to, do that so the next time things go downhill, everybody's ready and the pieces are in place. And as I said, the next pandemic or the next crisis like this could be just around the corner. And I warned people during the COVID pandemic that what was really worrisome to me was, while the COVID pandemic was going on, there was nothing, literally nothing, to prevent another pandemic starting right on top of it. And can you imagine a world with 2 health pandemics going on simultaneously, not just one, right? And now we have what appears to be the edges of another pandemic coming at us in the form of the Mpox situation. And who knows what's next. And folks, what's driving this behind the scenes, very seriously, actually is climate change. All the experts in public health agree that as the world warms, the prevalence of these kind of pandemics will just inevitably go up. And it's just a consequence of how disease functions in a warmer world. The best world to stop disease is a cold world, not a warm one. And as the world gets increasingly warmer, disease gets increasingly prevalent.
Well, Eric, thank you for that.
Sorry.
Yeah, perspective. Two more things very quickly, and then we need to close out our program. But there was a question. It says it sounds like mental health is consistently in need, but I didn't hear it mentioned as an area of wait list or an issue with accessibility. Is this accurate? Do people have access to appropriate mental health services without lengthy wait lists or funding issues?
So the question I was asked was, have things changed as a result of COVID? Oh, no, nothing about mental health changed as a result of COVID. It just got much worse in a variety of ways. So I believe most of the people in this meeting are aware that mental health services in Frederick County were not that great in 2018. In fact, they're not that great anywhere in America. The whole country has a mental health crisis going on. At least at least a couple of good things have happened in my lifetime. There's been increasing attention to mental health. There's been an increase in the recognition that mental health and physical health are basically just parts of the same thing. There's nothing special about mental health that should be treated differently in that regard. Mental health needs a lot of funding, and mental health is actually underlying a lot of physical health problems. But Frederick County already had huge waiting lists for access to mental health services before COVID. COVID may have actually, the shift to virtual teleservices may have helped a lot of people actually in that regard. But as I noted, especially if they'd not been accessing mental health services previously, the easiest shift to teleservices were those who hadn't been receiving them before. The most jarring shift was from direct services to teleservices. That was extremely challenging for people to make that transition. But no, Frederick County does not have an acceptable situation regarding waiting lists for mental health services, but neither does anywhere else in America. So there's nothing special about that. It's just an ongoing crisis. It's a crisis of funding, a crisis of service providers. Good luck trying to get additional mental health professionals to move into any place in America. They're in such high demand that there's just a deficit of them everywhere you go. And one of the things that's the hardest to tell somebody with a straight face is, maybe you should find yourself a therapist. That's a great thing to tell someone, but it's also like right now telling somebody maybe you should buy an electric vehicle. It's like, there are none for sale, right? So that's the problem, is that those disparities existed before COVID. There's the same now. And that's why my slide didn't talk about change. There was no change. The situation was already unacceptable before COVID occurred.
Thank you, Eric. And then one last question that is coming up in the chat is about how the key informants were selected. And I think that splashes back on the Community Foundation here, because Eric, as the consultant coming in from outside of the area, he doesn't know our folks. Back in 2011, when we did our first needs assessment, and again in 2018 and the 2022 update, we did a matrix as to what areas within human services we wanted to have discussion on, and whether it was mental health or children, whether it was aging, whether it was physical health care. And from that matrix, we then created lists of folks who could speak to those various issues. We also included some elected officials because we had to have some decision makers in the matrix as well. So it wasn't, we know them and they like to talk. We had specific representation within that key informant pool that we wanted to talk with, and that they could also speak in the first person. We also had some folks who represented people with lived experience on that as well.
Let me just follow in right behind that. If you look at the list in Appendix A, you're going to see many individuals on that list who are major thought leaders or other types of leaders in Frederick County. very few people on that list are going to be unknown to you in some context. And they are truly excellent people across the board to talk to about what's happening in Frederick County. And it was interesting to see on the mental health piece in particular, how much views and understandings of mental health have shifted in the last 10 years, across the board in Frederick County, not just with regard to the people who directly work in the mental health field, but also individuals who don't work in the mental health field. The recognition of the need, among other things, to not intersect mental health and criminal justice as much as you possibly can. And there has been a tendency in every community in America that when you have a really severe mental health crisis, you call the police. And there's also now recognition that that's not generally a good idea. The police don't want to be there because they're not trained to be there, and it's very frustrating for them. The mental health community recognizes, and the police recognize, and everybody else recognizes, you need mental health professionals to address mental health crises. And that shift is potent, it's powerful, and I think it's permanent in Frederick County. And that was one of the things I was greatly heartened by, is to see that shift, which means that a wide range of really important agencies and leaders in the county now all want to work together to make sure that mental health does not become a criminal justice issue, but becomes a treatment issue, and the responses are not centered in the criminal justice system when there is a mental health crisis. And that is a really important shift just on that particular front.
Thank you, Eric, for that. And we're about to close out our program. A couple of things I want to make mention of. First of all, these slides will be available, as well as the full report is on our website, and as well as the data visualization tool. Go in and play with it. It's kind of a neat little thing, but it's a clear depiction of how we compare to similar type communities. What is the Community Foundation doing? For our strategic grant funding, which is our discretionary monies, we are continuing to focus on the 2018 needs of addressing the needs of our aging population, addressing substance use disorder, and supporting families with children, especially those that fall within the ALICE category. But we're doing a preference, or as we call it, an overlay of mental health, affordable housing, and addressing diversity and the disparities in service delivery, such as grant applications, for an example, that are addressing senior issues and maybe knocking down barriers to getting them into affordable housing. That would get preference in our discretionary grant making. But we're still focused on those 2018 initiatives, but we're giving preference to the 2022. Our program is about to end. I want to thank you so much for participating today. We have your email addresses. We will be sending information out to you. Thank you to Dr. Rachel Mandel, Chairman of the Board of Trustees. And thank you to Ian Bartman, who's the champion of this strategic initiative for updating our needs assessment. Our Board of Trustees allocated this money, and it was a great investment for us because we do this on behalf of our community. Got to thank our staff. What a dream team I work with. And, thank you so much for your hard work on this. We thank the community leaders, the nonprofits, and everyone else who participated, and also those of you who will be asking us questions, because that means you're invested. That means you want to know more. So it's time for us to get to work, isn't it? And you'll be hearing more about this probably in October, after we have that meeting with the other funders, to figure out what parts do we want to play in addressing this. I hope you'll become involved as we formulate committees and collaboratives. We've got a lot of work to do, so let's get to work. Eric, thank you so much. And our program is now concluded. Have a great day, everyone.